this conflict that we see everywhere is a sign of distress, and that we all have a responsibility in addressing it.
Whether it's on Facebook or in your neighborhood streets, since the start of the pandemic, many have pushed back against COVID-19 restrictions or have spread what Montreal doctors say are dangerous conspiracy theories related to the virus.
People begin to say, oh, the virus doesn't exist, so there is no danger outside, or the virus exists, but it's not harmful.
Dr. Cecile Rousseau is the head of polarization clinical team for the CIUSSS West-Central Montreal, and she says it's something that's been witnessed in the last year with protests against public health measures and anti-mask or anti-vaccination movements in Quebec and the rest of Canada.
These movements, which are gaining popularity because people are more desperate. So in times of despair, people get attracted to groups who give them certainties and who help them find an enemy to say, okay, it's the fault of this or that group.
A survey commissioned by Quebec's Public Health Institute in 2020 found of the 3,000 respondents, nearly a quarter of them believed COVID-19 was created in a lab. 35% of them believed Quebec is hiding important information on the virus, and 1/3 felt the pandemic was being exaggerated in the media.
People have been losing their job, they've been losing money, they've been in dire conditions, survival conditions. This is hard. And you have good reason maybe to be angry and to be enraged at politicians who cannot provide a perfect solution.
1,600 threats to politicians were made last year, including to Dr. Horacio Arruda, Quebec's public health director. His home address was shared online by right-wing conspiracy theorists who have called him Doctor of Death and that he was imposing a dictatorship over Quebec because of public health measures during the first wave.
There is a middle group of people who are tempted, attracted by the conspiracy theory. And the more they go online, the more they have a self-fulfilling prophecy.
Dr. Rousseau believes that this middle group, people who aren't extremists, can be walked back from the conspiracy theories without using aggression or confrontation.
Showing empathy, understanding, asking questions, because the question is, are you sure that these people who say they have the truth?
Dr. Rousseau's Montreal clinic evaluates and supports those caught up in radicalization and wants to see more done for prevention.
Otherwise, these people will just become more desperate and more dangerous.
In Montreal, Alyssia Rubertucci, City News.